we have an immune system that was able to fight this off on our own, and that's really, really powerful.
I was there at Bloodworks Northwest when 37-year-old Elizabeth Snyder became the first plasma donor in Washington state to help UW researchers study antibodies. Elizabeth tells me she suffered what she would consider to be a mild case of COVID-19 back in February. She said she had a fever of 103 degrees, but no cough or respiratory issues.
Whatever is in my plasma and is in my white blood cells is extremely useful, both for research but also as a therapy for other people.
In that recovered plasma, there are proteins called antibodies, and those may be able to help people who are currently sick.
Dr. Becky Haley with Bloodworks Northwest, the collection agency for this new study, tells me Snyder and any other volunteer donor is first screened for any other infectious diseases before they come here to give plasma. That plasma can be used to create therapies with antibodies to treat others.
Each donation that goes for direct transfusion can probably treat 3 or 4 people.
Now that the first unit of plasma is in the lab, researchers are certainly looking for more.
The protocol from the NIH allows us to collect our COVID recovered donors once a week for up to 20 weeks.
Just like a vast wealth of information for researchers and for doctors.
Certainly research teams will be looking at the health of these individuals, the age of those producing the antibodies, just how strong those antibodies are, how long they stick around as well. All questions that these research teams will be looking to answer.
Ronald Lewis embodied the soulful spirit of New Orleans. He led the Big Nine Social Club, which hosts epic second-line parades around his lower Ninth Ward neighborhood. Hurricane Katrina took his home, but friends say he came back and became like a godfather of New Orleans culture.
He loved New Orleans. He understood the complexity of New Orleans. He brought out the best in us, in our ability to come together.
On March 18th, Lewis was rushed to the hospital. 2 days later, he died. It wasn't until the day of his funeral that his family says they learned he was infected with the coronavirus.
That was shocking. We didn't, he had just gone into the hospital, and I still really haven't wrapped my mind around it all the way.
Ronald Lewis's family says the 68-year-old suffered from diabetes and was recovering from a mild heart attack last year, but they never thought the COVID-19 infection would take his life. The mortality statistics across the country are jarring. In Louisiana, African Americans make up 32% of the population, but make up slightly more than 70% of coronavirus deaths. In Michigan and Illinois, African Americans make up about 15% of the overall population, yet account for about 40% of COVID-19 deaths.
This is an abomination, but it's not unexpected. And I want everyone to understand that New Orleans is a microcosm of every urban center in America.
Dr. Corey Hebert has worked as a physician in New Orleans for 25 years. He broke down the factors contributing to the high death rate among African Americans. There's underlying health issues like heart disease and diabetes. And if you drive around New Orleans, it's easy to find poor neighborhoods where people don't have access to health care. Many of these neighborhoods are food deserts where the best grocery store might be a corner store. It's a recipe for disaster, says Dr. Hebert.
When you are chronically oppressed, when you are chronically trying to get the scraps and the crumbs, that actually decreases your ability to have a good immune system because you're constantly in a fight or flight syndrome. Constantly with cortisol levels and epinephrine levels because you don't know where your next meal is going to come from. The odds of you saying, I'm going to get some broccoli for that next meal versus, a hamburger, that hamburger costs 99 cents and the broccoli is $3.99 a bunch, that's a life or death situation for you. And some people just really don't understand it.
So we're not worried about it at all?
It's fake.
But as the coronavirus started to spread around the world, social media conspiracy theories were also spreading even faster.
Minorities can't catch it.
Minorities can't catch coronavirus.
No.
Clips like these went viral. Medical experts worry this misinformation has kept and can keep many African Americans from getting life-saving information. Actor Idris Elba, who announced in March he was sickened by the coronavirus, took to social media to fight back at the disinformation.
Please stop sending the conspiracy theory nonsense about black people not being able to get coronavirus or COVID-19. It's dumb, it's silly, it's very dangerous. People need to know facts, need to understand the truth so that they can protect themselves. Stop sending this stuff out. It's very dangerous for all.
As the novel coronavirus first swept through China, millions went into lockdown, and factories like this one in Wuhu, where Ben Baltez's Toy Box 3D printers are made, went dark.
Our supply chain was completely shut down for 2 months.
But as China slowly restarts, Baltez's production is back up. And as millions in the U.S. are now under stay-at-home orders, Toy Box has seen sales go up, driven, he says, by the goodwill of his customers.
You know, without our help at all, they essentially formed a Facebook group, and our community was the one really driving it.
The Facebook group has become an online forum to share about various medical supplies that can be printed in 3D.
I just recently retired as a salon owner for 16 years, and I'm a stay-at-home mom now.
Jenny Lee from Southern California has mobilized her whole family to help. They are printing out Y splitters for ventilators. It's a simple plastic that channels air from one input to 2 outgoing tubes, potentially maximizing the use of ventilators, of which some hospitals are experiencing dire shortages.
So there's so many people that reach out to me, and I'm like loaded right now. I have like so many.
In Washington State, aerospace manufacturing engineer Christian Parker, working from home and joining in on that effort along with his 3 kids.
I am not a medical professional at all. But if this is something that I can give that helps save somebody's life or help take stress off of a doctor or take stress off of a nurse or whoever, and help on those front lines, if it does that, then I'm good and I'll keep doing it.
So the splitter will allow for one ventilator to be used by multiple patients.
Helen Shun at Johns Hopkins University says several hospitals in the U.S. without enough ventilators are now finding success with the simple Y splitter.
So usually you have one ventilator, one patient, and the clinician can change the settings to give the patient exactly what they need. But what happens when you have multiple patients on one splitter, you don't have as much fine-tuned control for the patients.
So she and her team are now working quickly to develop an advanced type of splitter. In the meantime, she says the simple splitters printed in homes across the U.S. appear to be effective, and they're allowing people of all ages to stay home and help.
Because usually we'll just print a toy and play with it, but now we're able to help people by printing what they need.
And I shipped out 10 units to a lady in California who's coordinating with hospitals in Zimbabwe and Ghana as well. So we're now reaching international locations.
Lee's family is now getting a request for other printed items, like S-clips for face masks.
I want to do something. At least I put a smile on the nurses and doctors, you know.
Nobody really saw coronavirus coming. Supply chains are shot right now, but anyone with a 3D printer is able to build these things at home now.
Baltez says it's not about people buying his product. In fact, he's made the source code for the splitters, S-clips, and even children's face masks free and available for any brand of 3D printer to use. From a factory in China to families in the U.S. creating their own at-home assembly lines, a globalized effort to give back. David Culver, CNN, Shanghai.